Welcome back. Right now we are joined by Alisa Lehman and Dr. Davis Liu to have an important discussion about heart health. Unfortunately, heart disease takes over 600,000 lives in this country alone a year. And there's things you can understand about your genetics that actually can help make a difference with this. Thank you, both of you, for joining us. In fact, Alisa, let's start with you. Tell me more about how genetics can play a role in understanding your risk of heart disease.
Yeah, so one thing that's important to remember is that when we're talking about DNA, most of us share most of our DNA. So you and I, most of our DNA is exactly the same. But there are certain places, certain bits of DNA that are different person to person. We call these genetic variants. And some of these variants may be associated with certain conditions. So at 23andMe, we look to see if you may have some of these genetic variants that are associated with a genetic predisposition to developing certain health conditions like type 2 diabetes or heart disease. Once you have that information, you can then work with your doctor to take steps to help prevent or manage these conditions.
Now, Alisa, tell me more about exactly what results you can get that provide information potentially about your risk within that test.
Yeah, so especially when we're talking about heart disease today, we have about 8 different reports that provide information about whether you may have an increased likelihood of developing conditions like high blood pressure, high cholesterol, coronary artery disease, all based on your genetics. It's important to remember, and we talk about this in the reports as well, that genetics may be new information to you about your chances of developing these conditions, but there are other factors that come into play that can help determine whether you actually go on to develop a disease. And a lot of these other factors are under your control. So things like your diet or your exercise habits.
And doctor, what would you recommend if someone receives this test back and it says that they are at a higher risk? What should they do?
Yes, they should definitely partner with their doctor and talk about their concerns about heart disease. It turns out it is the leading cause of death in this country, but it doesn't have to be. Only half of Americans who have high blood pressure have it well controlled. It should be less than 140/90. And then have a thoughtful conversation with a doctor about whether or not prescription medicines are used necessarily and thoughtfully, in addition to the lifestyle changes people know to do.
And where's the best place to go for more information?
Yeah, so if people are interested in learning more about what their genetics can say about their health, as well as their ancestry and the breadth of service that we offer at 23andMe, they can visit 23andme.com for more information.
Well, thank you so much, Alisa and Dr. Liu, for joining us today. I really appreciate your time and this important information about how genetic testing can play a role in understanding your risk of heart disease. So make sure that if you want more information, head to 23andMe. You can find out all that you need to know about that. And talk to your doctor if you're worried about your risk of heart disease. We'll be back with more right after this.